In Summit Rounds this week, we talked about spinal deformity. So let's talk a little bit about what is spinal deformity and what are some things that patients should understand about degenerative spinal deformity. Spinal deformity is really the end stage condition of arthritis in the spine. It basically means that a significant amount of arthritis has occurred and the spine has lost its function and stability. Patients can develop scoliosis, difficulty walking, their balance can be off, meaning that the spine is not in the right posture and orientation. Patients with spinal deformity are significantly disabled many times by the process. And it's a challenging situation and requires, I think, an interdisciplinary team working together to help the patients get their life back. We deal with many issues with regards to spinal deformity. For one, patients sometimes have osteoporosis or bone that's not particularly strong, and to correct a spinal deformity surgically is a challenge because of the soft bone, and spinal deformity can progress more because of the bone not being strong. Patients with spinal deformity tend to be less active because of the pain, and they lose muscle mass and strength. Their nutritional state may go down, and we need to address those things. Spinal deformity requires patients to work with physical therapists both before and after treatment, and to understand that there are many muscle groups in the body affected, such as tight hamstrings or hip flexor muscles. Spinal deformity can involve a small surgery for one area where there's really bad pinching of the nerves, or sometimes very large surgeries with large segment fusions and many screws and perhaps a lengthy recovery. I think that the message and the take-home point for patients is that if you have or struggle with degenerative scoliosis or some kind of deformity in the spine, consult with a team of providers. Find a group that works well together, and then work with that team to formulate a plan that may involve some time and effort to be prepared for surgical intervention. It may involve some creative thinking about the best ways to intervene, and then also may involve a significant recovery process after surgery. I do think that with technology the way it is, and by working as an interdisciplinary team, patients with spinal deformity can get their life back and have very good outcomes.